Okay, hi, Assalamualaikum warahmatullahi wabarakatuh. We are from R1454B and we will be presenting on the shoulder injuries. In this topic, we are going to learn about history of kinesiotaping and strapping, function of kinesiotaping and rigid tape, shoulder anatomy, causes and symptoms for shoulder injuries, equipment for taping, and different types of shoulder injuries and ways to tape them. Okay, first, history of kinesiotaping. Kinesiotaping was developed by Dr. Kenzo Kazek in Japan. In early 1970s, he started searching for a taping method that can help the process of healing for tissue and muscle injuries. He found a taping technique that provided support, but they kind of limited the range of motion for the injured side. So in 1973, he determined to create a taping technique that can support impact joint and muscle, but still did not limit the range of motion. First kinesiotape was first exposed during the 1988 Seoul Olympic. Okay, next is function of rigid tape. We use rigid tape when we want to strap the injury site. Okay, the function of rigid tapes are they provide joint stability, strong postural support, and arch support. But you guys need to know that rigid tape limit the range of motion at the injury site. Okay. Meanwhile, the function of kinesiotape are they provide joint and muscle support and also mild postural support. They still support the injured side, but they did not limit the range of motion like rigid tape. And these are the shoulder anatomy that we are going to learn today. Causes and symptoms for shoulder injuries. Okay, for the causes are first, repetitive activities or heavy lifting over a prolonged period of time. Second is degenerative tear. This tear happens due to aging. Okay, next is sport injuries. For example, tackle in football, grumping in rugby, they can lead to shoulder injury. Okay, next is fall. For example, when you fall from high place and you land on your shoulder first, and that's going to injure your shoulder. Okay, next is trauma not related in sport, such as tripping over wet floor and many more. Okay. Symptoms for shoulder injuries. First, the pain that keep coming back, the pain that prevent you from sleeping on the injured side. For example, if you injured on your right, you cannot sleep on your right side. Okay, next is muscle weakness, limited ability to move your arm. When you injure your shoulder, you will have limited range of motion. For example, if in the past you can do a circular motion, but when you have, for example, like shoulder dislocate, you cannot move your arm in circular motion like you normally did. Okay, next is numbness and tingling sensation, and the last one is changes in temperature or skin color. Okay, equipment for taping. When you want to tape, you will need a kinesiology tape or rigid tape and scissors if you need scissors to use.
Okay, for do and don'ts while tapping, strapping, and kinesiology tapping. Okay, in general, for do, you must take affected area firm and nicely, and you must clip or trim hair close to skin on heavily forest areas. And for don'ts, don't stretch the tape all the way to the ends, and don't tape too hard that can cut blood circulation. Okay, that's all from me.
Assalamualaikum warahmatullahi wabarakatuh. My name is Muhammad Aisyah Muhammad, and today I'll be talking on what is an AC joint spring. So the AC, which stands for acromioclavicular joint, is formed where a portion of the scapula and the clavicle meet and are held together by tough tissues, which are called ligaments, and that act like tethers to keep the bones in place. And it is commonly the result of a direct fall to the shoulder that injures the ligaments that surround and stabilize the AC joint. So if the force is severe enough, the ligaments attaching to the underside of the clavicle are torn, causing separation of the collarbone and wing bone. The scapula moves downward from the weight of the arm, creating a bump or bulge above the shoulder. So there are 6 levels of AC joint injuries. So for type 1, is the ligament in the AC joint is stretched. And for type 2, is the puncture rupture in the AC ligaments. Type 3 is the complete rupture in the AC and CC ligaments. For the type 4 is the clavicle displaced posterior over the acromion. For type 5 is the clavicle displaced just under the skin. And the last type, which is type 6, is the clavicle underneath coracoid. So the last type is very rare and it doesn't happen regularly. I'll be explaining on how to use kinesiotape on the AC joint spring. So there are 5 steps. The first one is that you prepare 4 strips of kinesiology tapes that you've measured for the affected area. Make sure to round the edges to make the kinesio tape stay on longer. The second step is to put the patient arms in the resting position. Get your first strip and put it on the anchor point with 0% tension. And for the therapeutic zone, give the kin tape 75 to 100% tension and put it diagonally across the AC joint. This amount of tension does not have recoil, but it gives stability to the area. And the third step is to get your second strip and add 75 to 100% tension to it. Place it diagonally on the first strip, forming an X pattern. Make sure to not add tension on the ends again. And the fourth step is to again add another 75 to 100% tension for your third strip. And you have to position the tape in the same position as the first tape, but at a slightly lesser angle. And for the last step is that you add another 75 to 1% tension on the last strip and position it in the direction of the second strip at a slightly lesser angle. So that is how you use the kinesio tape on the AC joint sprain injury.
Okay, Assalamualaikum warahmatullahi wabarakatuh. My name is Muhammad Izzat Muhammad and I'm from RS1454B. So today I'll be showing how to use the kinesio tape to tape for the AC joint sprain injury. So this is the example of kinesio tape. And what you want to do is to cut it into 4 smaller pieces like this, to become 4 strips like this. Okay, and make sure you cut the edges so that when the person that has the kinesio tape on open or wearing their clothes, the kinesio tape won't be easily peel off. Okay, so let me show you the first strip. Okay. Okay, so for the first strip, this is the area of the AC joint. Okay, around here. So what you do is you want to put 75 to 100% tension. Put it like this, 75 to 100% tension, and you tape it. Make sure that you put no tension towards the anchor, this area, and the middle area is called the therapeutic zone. Okay, so the aim for the first strip is to the tension does not have any recoil, but we want stability on the AC joint. Okay, so move on to the second strip. For the second strip, you need to put it diagonally across the first strip. Make it like an X shape. Okay, 75 to 100% tension. The middle part, you tape it, and then put no tension towards the anchor. This, like this. Okay, X shape. Okay. For the third strip, we want to go it like this, a slightly less angle than the second strip. Okay, again with the same tension, 75 to 100% tension. Okay, so let me show you. Okay, like this, 75 to 100% tension. Take the middle part and put no tension towards the anchor zone, which is this area. Okay. Okay, for the fourth strip, the last strip, you put it across here, slightly less angle than the third strip. Again with the same tension, 75 to 100% tension, like this. Wait. Okay, like this. This is zero tension, 75 to 100% tension. You put it like this. Take the middle part. Okay, make sure take the middle part and put no tension towards the end. This. Okay, you can see. I want to give the stability towards the AC joint sprain injury. So, okay. So as I explained just now, all the strips you need to put 75 to 100% tension, but avoid putting tension on the end of the strips. Okay. So that is how you use kinesio tape to tape on the injury of AC joint sprain. So that is all from me. Thank you.
Place an underwrap tape before you begin, but in this video I didn't put any underwrap tape because I didn't have it, and the athletes are okay with me doing the strapping without underwrap tape. First, make a few anchors moving forward from the back of the collarbone. Put downward pressure on the collarbone. Then, we move to make another anchor around the forearm. I also ask the athlete to lift the arm up a little bit to activate the upper trapezius. After that, I started to tape the back of the forearm up until it meets the ankle on the shoulder. I apply some pressure to make sure that the tape pulls the muscle out. Then I move to the front of the forearm and I repeat the same step that I made at the back of the forearm. I repeat the same step by stripping the front and back consecutively. And lastly, I secure the tape by taping around the ankles 2 times, both shoulder and the forearms.
Rotator cuff is a group of muscles and tendons that surround the shoulder joint, keeping the head of your upper arm bone firmly within the shallow socket of the shoulder. The common sport that use the muscle of rotator cuff, such as baseball, swimming, and tennis. There are 4 muscles and tendons of the rotator cuff, which are supraspinatus, infraspinatus, teres minor, and subscapularis. Each of them aids in the specific motion of your shoulder. Altogether, they help to hold your upper arm in place in the shoulder socket. Rotator cuff injury happen when one or more of the rotator cuff tendon is torn. Most here occur in the supraspinatus tendon, but other part of rotator cuff may also be involved. There are 2 levels of rotator cuff tear. First is partial tear, and second is full thickness tear. A partial tear happens when one of the muscles that form the rotator cuff is damaged, and for the full thickness tear, it will happen when the tendon is totally separates from the bone, or it can call a complete tear. For kinesiotaping for rotator cuff injury, it requires 1 full kinesiotape and 2 half kinesiotape. The first step is place the tape on the side and slightly in front of the shoulder with 0 stretch. Next step is stretch the tape 25% and pull it all the way and then back it off 50%. And at the end of the kinesiotape, do not apply any stretch. After that, finish it with gentle rub over the strip to improve the adhesion. The next step is take the half kinesiotape and then put the tape across the muscle in the back of shoulder with 80% of stretch on the middle of the kinesiotape. And after that, finish it with gentle rub over the strip to improve the adhesion. The third step is take the second half of the kinesiotape and then place it next to the first half strip with the same 80% stretch on the middle of kinesiotape and finish it with a gentle rub to improve the adhesion.
Assalamualaikum warahmatullahi wabarakatuh. My name is Muhammad Yasir bin Muhammad Supri. So today I'm gonna show you, demonstrate you how to strapping for rotator cuff strain. Actually rotator cuff strain injury at this area when your supraspinatus tendon tear or strain. So the most tear occur in supraspinatus tendon, but other part of the rotator cuff may also be involved. So procedure to strapping is first. Place a strip. Take around the upper arm, keeping a bicep tense to lock like this. Like this. And then we cut the tape. Next, we start now from pectoralis major, but we start behind. I'm sorry, we start from behind. Scapula bone, we pull these two pectoralis major and close the spinatus tendon was here. And again, this, and next we start from below of the thought and pull until the tip on spinatus tendon and lock. We do for 3 times to lock the joint to avoid and prevent the injury, right? Lastly, we do a cross to lock, double confirmation to lock like this. Now, so the supranucleus tendon. And last, so that's for rotator curve strength for strapping. That's all from me. From me, thank you.
Okay, Assalamualaikum warahmatullahi wabarakatuh. So we move to the shoulder dislocation. So what is the shoulder dislocation? Shoulder dislocation when the cervical ball or circle ball at the top of the shoulder or the top of the upper arm, or we know as humerus, lift the socket of your shoulder blade or your scapula or shoulder dislocation occur. That indicate shoulder bone and socket bone are separate and the humerus ball out of a place. So that's what we call shoulder dislocation. So anatomy of injury, shoulder dislocation, actually there are not too much different between shoulder dislocation and anterior dislocation. Okay, anatomy of injury shoulder dislocation is shoulder dislocation occur when the connection between the humerus and the granite, your socket, or known as the ball and socket joint in the shoulder become unstable or out of place, as with a shoulder separation and injury to the ligament that stabilize the joint is involved. Actually, we move to the type of shoulder dislocation. Shoulder dislocation have a two type injury. For example, anterior shoulder dislocation and posterior shoulder dislocation. So I'm gonna explain about posterior dislocation. So posterior shoulder dislocation is an internal blow to the front of the shoulder cause the humerus is subject in a direct force that include flexion, abduction, internal rotation. That is frequently caused by tripping over the outstretched hand because of the traumatic nature of the injury. Posterior dislocation might result in labral or rotator cuff disease. So to type anterior and posterior shoulder dislocation.
Okay, so next we go to how to treat shoulder dislocation using a kinesiology tape. So first, we use a mini towel to remove oily skin. Okay, first step, just lay down the tape on the ball and socket joint. Like this. And do a C shape, a little bit stretch until below the deltoid, like this. Okay, so next we move to the interior. Okay, so lay down the tape on the first tape and stretch a little bit to do a C shape until below the deltoid, like this. So next, for third, lay down the tape, the posterior of the shoulder on the scapula or trapezius muscle, like this, and stretch 80%, like this, to other side. Please raise your hand, cross the yes, like that. Okay, so next, same tape and stretch 80% on this tape. Stretch this. Okay, now raise your lay down your hand. Okay, last step, you must put the tape on the shoulder, on the socket and ball joint. Lay down and stretch 80%. This 80%. So that's kinesthetic used for shoulder dislocation. That's all from me. Thank you.
And I will show you the procedure of to do a strapping for shoulder anterior dislocation. And the equipment that we must use is we must have a strapping tape and scissors. Okay, first start taping by applying anchors over the shoulder and the bicep muscle in the front part of the upper arm. Apply a piece of tape from the base of the nipple up and over the top of the shoulder to about mid-shoulder blade level. Lay 1 or 2 more strips of tape over the first for firm support. Okay, then wrap 2 or 3 straps of tape around the middle of the bicep muscle. And protect the shoulder by applying 2 or 4 strips of tape diagonally in opposite direction from one angle to the other. This should form an X or cross pattern around the shoulder with the intersection centered over the lateral muscles, which is deltoid. Two strips of tape is the minimum, whereas doubling it up with 3 strips will provide more stability. Start at the outside edge of the nipple and run a strip of tape over the shoulder. And wrap it around and under the biceps of the upper arm. You are connecting the 2 anchors again, but from the front instead at the side. Okay, done.